Introduction. Effective communication between patients and care providers is a very important element of good medical practice. It does not only revolve around the patient and physician but extends to other persons included in the healthcare system such patient families, consultants, referring physicians, the establishment providing the care, and so on. Effective communication in healthcare is critical for numerous medical processes such as correct diagnosis, correct care and treatment, legal and ethical issues, and in checking the medical progress of patients. Excellence in listening and talking between healthcare professionals, patients, and other stakeholders should be one of the top priorities that should be achieved in the provision of good and effective care to patients. The importance of communication in healthcare is often underestimated, and as a result, the needs of the patients and other persons are not always met. This ultimately has an undesired impact on the reputation of the individual physician and the institution in general. When communication is ineffective in any healthcare setting, then there is bound to be poor medical care and medical mistakes. Studies over the recent years have identified ineffective communication as a serious cause for concern in the provision of healthcare. With lives in the balance, effective communication is a very important component of good care provision. Effective communication in the healthcare procedure. Effective communication in healthcare is very important in diagnostic procedures since this procedure marks the beginning of the medical procedure in most patients. Any mistake occurring at this stage could have very significant effects on the outcome of the process. It is imperative that both the patient and healthcare provider are clear on all communication processes. If the patient provides contradictory information regarding the symptoms and past experiences, the physician may make inaccurate diagnostic recommendations that can lead to mistreatment of the condition, creating new complications or worsening the patient's condition. During the diagnostic procedure, physicians should allow the patient enough time to express themselves to improve the accuracy of this process. Studies show that clinicians only allow their patients 18% to express themselves before interrupting. The same research found out that a mere 2% of patients ever get the chance to express themselves in full. By reducing the amount of information from the patient, the physician is frequently deprived of facts that are vital in making an accurate diagnosis. Various studies also suggest that communication between physician and patient is the most important indicator of patient observance of a treatment plan. If the physician possesses effective communication skills, the patient will become an active participant during diagnostic procedure, thus reducing the likelihood of making an inaccurate diagnosis. During the diagnostic procedure, the patient must be clear in communicating his/her medical history to the physician. Conditions such as drug allergies, previous surgeries, and ailments are critical in choosing a treatment plan for the patient. Failure by patients to communicate their medical history effectively can place them at risk. For instance, failing to mention an allergy to penicillin may result into the patient having an anaphylactic shock. Effectiveness in communication is also important in the treatment process. Physicians must know how to communicate medication instructions and home care to patients. Failure may result in overdose or general failure to adhere to the treatment option recommended by the physician, leading to a worsening of the patient's condition or other serious complications and side effects. Once a patient receives treatment, the physician has to make follow-ups to ascertain the medical progress. Effective information can assist the hospital to determine whether the patient is making progress, allergy to drugs, or side effects and decide whether to alter the treatment plan. Patient engagement. At any stage of the medical procedure, physicians must engage patients to improve the accuracy and efficacy of the process. Engagement can only be achieved if the physician possesses effective communication skills. Engagement is important as it creates a connection between the patient and physician and establishes a close partnership between the two parties. Obstacles to engagement include physician failure to introduce oneself appropriately, cutting short the patient's presentation, and using inquisition-type questions. Strategies for successful engagement comprise showing genuine interest in the patient, prioritizing the patient's story, and discussing the program or topic for the next visit in advance and using language that is easily understood by patients. The results of a successful engagement include an improvement of qualitative and quantitative information available for diagnostic, treatment, and follow-up procedures that will significantly improve healthcare provision. Besides, the patient will have a feeling of partnership that may aid their adherence to the treatment regime. Conclusion: effective communication is important in all aspects of healthcare provision for both the patient and healthcare provider. At the diagnosis stage, effective communication helps in obtaining quality information from the patient that helps coming up with an accurate treatment regimen. During the treatment process, communication helps in communicating medication instructions and determining the progress of the patients. At each stage of the treatment process, healthcare providers must employ engagement strategies to improve the accuracy and efficacy of the whole process. This and many other essays are available at studycorgi.com.